Niacin's influence on mental health, particularly anxiety and mood disorders, is a striking example of how essential nutrients can shape neurochemistry in subtle but powerful ways, yet still remain largely unacknowledged in mainstream psychiatric treatment. While pharmacological approaches like SSRIs dominate the mental health landscape, nutrients such as vitamin B3, niacin, form the biochemical foundation upon which neurotransmitter systems are built. Niacin's role in tryptophan metabolism directly affects serotonin synthesis, while its broader effects on mitochondrial function, inflammation, and redox balance also modulate brain chemistry in ways relevant to emotional regulation and cognitive clarity. At the center of this connection is the biochemical pathway through which tryptophan, an amino acid found in protein-rich foods, is converted into serotonin, the neurotransmitter often called the feel-good chemical. This pathway is not straightforward. Tryptophan must first survive competition with other amino acids for transport into the brain, and then avoid being diverted down the kynurenine pathway, a process heavily influenced by inflammation and stress. One key regulator of where tryptophan ends up is niacin. Niacin and tryptophan are biochemically intertwined. The body can synthesize niacin from tryptophan via the kynurenine pathway, but this conversion is inefficient and becomes even less so under conditions of stress, inflammation, or B6 deficiency. When niacin intake is low, the body compensates by using more tryptophan to make NAD+, which depletes the pool of tryptophan available for serotonin production. This is a critical but underappreciated mechanism. In effect, a deficiency in B3 can indirectly lead to a drop in serotonin levels, not because there's not enough tryptophan, but because that tryptophan is being rerouted to meet the body's niacin needs. This metabolic trade-off may explain why people with subclinical niacin deficiency often experience symptoms like irritability, anxiety, low mood, and mental fog. These symptoms are not always dramatic, but they are persistent, and they mimic common psychiatric presentations. Unfortunately, most mental health evaluations don't include any assessment of B vitamin status. Instead, the standard treatment pathway often begins with pharmaceutical interventions, particularly SSRIs, which block serotonin reuptake to increase its availability in the synaptic cleft. While this can be effective in many cases, it doesn't address the upstream issue of serotonin synthesis, which may be impaired due to nutritional deficiencies, including niacin. Moreover, niacin influences more than serotonin. It also plays a role in the synthesis and function of dopamine, the neurotransmitter associated with motivation, focus, and reward. Dopaminergic neurons are highly energy-dependent and sensitive to oxidative stress, two domains in which niacin, through its role in NAD+/NADH cycling and mitochondrial protection, is critically involved. Low levels of niacin can therefore disrupt dopamine balance, potentially contributing to symptoms like apathy, low energy, and even features of depression or attention disorders. Additionally, niacin has anti-inflammatory properties through its modulation of microglial activity and cytokine production. Chronic low-grade inflammation is increasingly recognized as a contributor to mood disorders, particularly depression. Niacinamide, a non-flushing form of B3, has been shown to suppress inflammatory cytokines like IL-6 and TNF-alpha in the brain, offering neuroprotective and mood-stabilizing effects that parallel, and in some cases complement, pharmacological treatments. There's also historical precedent. Abram Hoffer, a Canadian psychiatrist, famously used high doses of niacin to treat schizophrenia and severe depression in the mid-20th century. While his methods were controversial and lacked the large-scale clinical trials required for mainstream adoption, many patients reported significant improvements. Some modern functional psychiatrists and integrative physicians still use niacin in similar protocols, particularly for patients who are medication-resistant or who prefer nutritional strategies over pharmaceuticals. Despite all this, niacin remains mostly ignored in psychiatry, largely due to a research and clinical culture that favors drugs over nutrients. There is a prevailing skepticism toward nutritional psychiatry, and when studies are done, they are often small, poorly funded, or methodologically limited. This leaves clinicians without clear guidelines and patients without awareness that something as simple as a vitamin might support their mental health. That said, niacin is not a panacea. Its effectiveness varies based on the individual's overall nutritional status, genetic background, gut health, and the nature of their mental health challenges. High doses, especially of nicotinic acid, can cause uncomfortable flushing or liver enzyme elevations if not used carefully. However, for many individuals with low-level mood disturbances, stress-related anxiety, or unexplained irritability, moderate niacin supplementation, especially in the niacinamide form, may provide meaningful relief without the side effects of pharmaceutical drugs. In conclusion, niacin is a silent contributor to emotional stability and mental resilience. By supporting serotonin and dopamine synthesis, reducing neuroinflammation, and optimizing cellular energy, it acts at multiple levels to influence mood and anxiety. Its obscurity in mental health care reflects broader blind spots in how we view nutrition, not as an intervention, but as a prerequisite for optimal brain function. Reintegrating niacin into the conversation on mood disorders doesn't mean replacing medications, but rather strengthening the metabolic foundation upon which all psychological health depends.